Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. A big thank you to all who have subscribed to this channel. Your support is much appreciated. This is a channel where we educate ourselves on common health problems. So if you're new to this channel and you want to learn more about your health, then please hit on that subscribe button and also on the notification bell so you don't miss anything that I upload. Today, I'm going to be spending some time with you talking about sunburn. We're going to be looking at the causes of sunburn, some symptoms that you need to look out for, and some alarming symptoms that you need to report straight to your doctor. We'll also be looking at ways of preventing sunburn and also some complications that you can experience when you continually expose your skin to the sun. So let's get into the video. Many different types of rays present in sunlight, and the most damaging ones are called ultraviolet rays. There are two of them that reach the Earth's surface, and these are the ultraviolet A or UVA and ultraviolet B or UVB. UVA is responsible for skin aging, and UVB is responsible for sunburn. The outer layer of the skin is made up of a dark pigment called melanin. Melanin gives the skin its normal color. When you get exposed to UV light, your skin protects itself by producing melanin faster, and the extra melanin creates the tan. A suntan is the body's way of blocking UV rays to prevent sunburn. The protection only goes so far, and too much exposure to UV light causes the skin to burn. Sunburn is an acute inflammatory response of the skin due to overexposure to UV radiation from the sun or from an artificial source, such as sun lamps and tanning beds. There are actually some things that can put you at risk of getting sunburn, and these include having light skin, working outdoors, regularly exposing unprotected skin to UV light from sunlight or artificial sources such as tanning beds, taking a drug that makes you more likely to burn, and living in a hot country where the sun is very intense. Also having a family history of skin cancer. People with naturally dark skin are less likely to get skin cancer, as darker skin has some protection against UV rays, but skin cancer can still occur. Now let's move on to the symptoms of sunburn. The skin becomes red and hot, very sore and flaky, and it will peel after some days. It gets better within a few days, usually within 7 days. And once you get burnt, there are things that you can do to ease the pain. And these include getting out of the sun as soon as possible. Cool your skin with a cool shower, bath, or damp towel. Apply some sun cream or aloe vera spray. Drink plenty of water to cool down and prevent dehydration, and cover the sunburned skin from direct sunlight until skin has fully healed. Take some ibuprofen or paracetamol if the pain resulting from the burn is unbearable. But before you do this, make sure you read the patient information leaflet in the pack, or better still, speak to your pharmacist so they can advise you appropriately. There are some things also that you need to avoid when your skin gets burnt. And these include, do not apply petroleum jelly or Vaseline on sunburned skin. Do not put ice or ice packs on sunburned skin. If you develop blisters, do not pop them, as this can lead to an infection. And try not to scratch or remove peeling skin. Do not wear tight-fitting clothes over sunburned skin. There are also some alarming symptoms that you would urgently have to visit your doctor and report them to, or you would need to call the emergency services. And these include when your skin is blistered or swollen, when your temperature rises or you feel hot or shivery, when you feel very tired and dizzy, when you develop a headache or muscle cramp, or when your baby or young child has sunburn, and when your sunburn does not improve within a few days. Now let's talk about some preventive measures that you can take to protect your skin from burning. Preventive measure number 1, spend time in the shade when the sun is strongest, usually between 11 a.m. to 3 p.m. You can schedule outdoor activities at other times in the day. And if that is not possible, then limit the time you spend in the sun. Number 2, cover up. That is, wear a wide-brimmed hat that shades the face, neck, and ears. A long-sleeved top, trousers, or long skirts in close-weave fabrics that do not allow sunlight to pass through. Number 3, use sunscreen frequently and generously. You can buy these products from your local pharmacy and use one that is still in date. It should be a broad spectrum one. That is, it should provide protection against both UVA and UVB rays. Use the type that has got zinc oxide or titanium oxide, as these are safe and cause less skin irritation. A sunscreen with a sun protection factor of at least 30 is recommended, and at least a 4-star UVA protection. The star rating for UVA measures the amount of UVA radiation protection. The higher the star rating, the better. Some people think that if you use a sunscreen with a sun protection factor of 30, then it means you can stay in the sun for 30 hours without getting burnt. This is actually not the case. In actual fact, sun protection factor is a measure of how well the sunscreen protects against UVB rays. It is calculated based on how long it takes to sunburn skin treated with the sunscreen as compared to skin with no sunscreen. Apply the sunscreen 15 to 30 minutes before going outdoors and reapply every 2 hours, and also after swimming or sweating. Use sunscreen even when it is cloudy. Even though people with darker skin are less likely to get sunburn, it is still advisable that people with all skin tones use sun protection to prevent skin damage. Preventive measure number 4, avoid using sunbeds, sun lamps, and tanning beds. The British Association of Dermatologists advised that it is not advisable to use these because they are more dangerous than natural sunlight, as they use a more concentrated source of UV radiation and can cause long-term skin complications. And point number 5, wear wrap-around sunglasses when outdoors and choose one that provides both UVA and UVB protection. And point number 6, be aware of sun-sensitizing medications. These are drugs that can make the skin more sensitive to sunlight, and examples are some antibiotics, retinoids, and some antidepressants, just to name a few. If you're concerned about any medication that you are taking, then speak to your pharmacist, and I'm sure they will be able to advise you appropriately. And the last preventive measure, number 7, avoid using sunscreen in children younger than 6 months. Instead, try to limit their exposure to sunlight. It is best to carry out these preventive measures because apart from the skin getting burnt, prolonged exposure to the sun can result in complications like premature aging. That is, the skin becomes wrinkled, leathery, and thick. There can also be skin cancer, and you can also develop cataract, which is an eye condition that can lead to blindness. And there's also the risk of developing eyelid cancers. There can also be an immune system suppression. UV radiation weakens the immune system, resulting in a reduction of the skin's ability to protect against infection and cancers. So far, we have been looking at some causes of sunburn, some symptoms that you can experience when you get sunburn, and some alarming symptoms that you need to report to your doctor immediately when you experience them. Also, we've been looking into details about some preventive measures that you can carry out to prevent sunburn and some complications that you can experience after prolonged exposure of the skin to the sun. I hope you have learned something today. If you have, then please give this video a thumbs up. Remember to share with family and friends, and leave your comments, your questions, and your suggestions in the comment section. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss anything that I upload. Thank you so much for joining me today, and I hope to see you soon in my next video. Bye for now.